Hello, ladies and gentlemen. Welcome to another episode of The Blind. I'm your host, Tifase Biza. Today, I'm with Joanna Mpoyo. She works in the healthy field, especially with Beehive, an organization partnering with hospitals to donate essential items. So, Joanna,
Yes.
welcome.
Thank you very much.
Yeah, can you introduce yourself and your role at Beehive?
Okay, I am Joanna Mpoyo. So I work with Beehive as a health desk coordinator. So I've been working with them for the past 3 years.
How did you become involved with Beehive?
So I recently got involved with Beehive. That was in 2021. Yeah, I recently applied for the job in there. So at first I wasn't a health coordinator, as we all know, but I was enrolled as an outreach worker. So as you all know, work related stuffs. After some things that happened, that's when we got promoted to become a health desk coordinator.
Okay, that's interesting. All right, so what inspired Beehive to partner with hospitals?
Okay, Beehive, as we all know it, is an organization that works to improve the lives of people in Chilomoni. So Beehives work in a lot of field. We do work in the education sector. We also work in helping to handle cases including gender-based violences, abuses, and also part of health. We do also engage into those things. So Beehive is really involved into a lot of things. Yeah, I can say that in general.
All right, coming to Beehive's mission and goals, what is Beehive's primary mission?
We can say that the primary mission is to improve the lives of people in Chiromoni and the lives of people around the cross. We mostly know that Beehive is located in Chilomoni, and we have a cross which is located on Michiru Mountain. So Beehive mostly works around the community that are involved around the cross which is on Michiru Mountain. As long as you can view the cross, you are able to benefit from the services of Beehive.
Oh.
Yeah, that's our catchment area.
All right.
Yeah.
All right. How do you aim to improve healthy care through your donations?
Right now, we do work hand in hand with a lot of health facilities. We do offer transportation in terms of bringing the hospital closer to the community. This is to include in our outreach clinic program. So in this outreach clinic program, right now we're working with Chilomoni Health Facility. We do work around with HSAs administering health services, including growth monitoring services, family planning methods, and also some other small clinics. Yeah.
All right. What are specific goals do you hope to achieve in the next year?
So as an organization, we do really hope that we become a full member. We can also say that a full member of Chilomoni Health Facilities. As you can see that this partnership has just been strengthened right now. So we just want it to grow so that we can reach more lives around Chilomoni. So as Beehive, we are there to promote the health and the well-being of the people around Chilomoni.
All right. There are many hospitals in Chilomon. So how do you select hospitals to partner with? Or do you only partner with those hospitals, government hospitals? Or
Okay, yeah. To say the truth, right now we are mostly working with government hospitals. I can say that Chilomoni Health Facility is not the only hospital in which we are working hand in hand with. There are many hospitals. We have Chimembe Health Facility. We also have Queen Elizabeth Mental Hospital in which we are working hand in hand with. Yeah. But there is no precise procedure in which hospital can be in partner with us. Yeah.
All right. What types of donations do you typically provide?
I can say that in the past month we were able to provide PPEs, which are personal protective equipments, to hospitals, which were masks, aprons, other diapers. There are a lot of things in which we donate to hospitals. Yeah.
All right. So can you share success stories from your hospital partnerships?
Okay. Since our time working with Chilomoni Health Facility, we do encounter so many cases there. For example, we do encounter children with special education needs and disabilities. Some are also minorities. So, as Chilomoni Health Facility, as a partner, we do work in partnership with each other to improve the lives of those people. We had, for instance, a case of one special child who had disability. So we also offer special education needs and disability education at our center. So we refer those children to our center so that they should be gaining extra knowledge in terms of education, and also that's all I can say for now. Yeah.
And also they're healthy. All right.
So another case right now in which we encounter that as our success, as we all know that Beehive, apart from doing this organization thing and charitable things, we also do have schools, and also we do offer sessions at our center. So we encounter so many cases there. For example, we had another issue in which we had a issue of scabies. There was an investigation of scabies, cholera. So we worked hand in hand with the Chilomoni Health Facility in civic education, in civic educating the parents on how best they can care for their children, how they can be very hygienic in their homes, school. So we do work in hand with Chilomoni Health Facility, and also in educating parents on family planning methods and also cervical cancer issues. Yeah, that's all I can say.
All right. How do you determine what items to donate?
Right now, we don't even determine what items we need to donate, because it just depends on the items in which we are in possession with. So past in the past month, we had an excess amount of PPEs, which are personal protective equipment. So we really do thought about our partners. So we just thought that we had just to share with them. Yeah. We do also have an extra supply of hand sanitizers, face shields. Yeah. So as long as we have those things in excess, that's when we do donate them to our partners.
Okay. All right. So what's the process for correcting and distributing donations?
Right now, on the process of correcting materials for donations, we do rely on our friends. As you all know, Beehive is an international organization in which there are people in the UK in which who donate staffs to come here to help in here as Malawi as a whole. So those donations in which we receive, we are able also to donate to our friends in those in which we are working in partnership, mainly including Chilomon Health Facilities and also Chimembe and also Queens.
Okay, so they do send those things from outside the country.
Yeah.
All right. So how do you ensure donated items meet hospital standards?
We do have a list in which the health facilities do come to us and say, in this time we are in lack of these things. So we really hope that whenever you come across these things, you can really help us. So as also a part, we are also working with the district health office, and there we also encounter issues in which we understand the problems in which our hospitals are going through and how best we can help them. Yeah.
Okay. Coming to some impacts and outcomes, how do you measure the impact of Beehive's donations?
Right now, we can say the best way in which we measure Beehive's successes and their impact in the lives of people, it is through the people we encounter every time we go out for outreach clinics. We do understand right now we are conducting about 5 outreach clinics around Chilomone and also Jemusa. So when we go to those sessions and we conduct the outreach clinics, by the number of people in which they are coming to attend those services and to be helped in those services, that's when we realize that this is really impacting the community and a lot of people are being helped. So we do take that from the data which we collect in those sessions.
All right. So, can you share any statistics or testimonials from hospitals?
So right now, I can say about is Chilomoni Health Facility. Right now, they are able to conduct a lot of services within Chilomoni. There are some places which are unreachable, but because of our help in providing transportation, they are able to reach a lot of places in which in the current time they were unreachable. So I can say that right now we are really impacting the community, and also the hospitals, they are really thankful of the good job in which we are doing.
Mm. How have your donations improved patient care?
Our donations have really improved patient care because right now, as you can see, that it is a long distance for someone from Jemusa to come to Chilomoni Health Facilities. From someone to say from Mulunguzi to travel and come to Chilomoni. So because of us bringing the hospital closer to the community, it has really impacted a lot of people and a lot of lives, because health right now, it is not an expensive thing. It is a thing in which they can gain access as long as they are within our catchment area. Yeah.
Okay, I do believe that you do also face some challenges. Uh, what challenges do you face in securing donations?
Yeah, I can say that for us to get donation, it is a one-time thing. It requires the donor that he has donated excess. So right now, the only thing I can say in terms of working with hospitals, the only thing we are able to donate right now is the means of transportation. Donations, they are not regularly being given out in terms of materials and stuffs, but the only thing we are able to donate right now is only transportation. And we go into the hospitals, we found out that there are a lot of issues. Yes, we really want to help, but because we don't have the resources, there is nothing we can do right now.
Mm. And how do you overcome those challenges?
Right now, we really need a lot of partners in which they can be helping us with resources, in which we can be helping a lot of hospitals that are here in Chilomoni. So as part of that team that is working to improve the lives of people in Chilomoni, we have approached the other organizations for proposals to help us in this segment. Yeah.
Okay. Coming to opportunities, are there opportunities for expansion or new partnerships?
Yes, there are opportunities for expansion and new partnerships. As you can see, for the past month, we were able to donate even to Chimembe Health Facility. That means we are growing. It is not only Chilomoni Health Facility in which we are looking towards to. And also at the same time, we are also working with Queen Elizabeth Central Hospital. They were once partners because we also work with children with special education needs and disabilities. So they are our customers in terms of buying wheelchairs and other equipments. So right now, it seems as the bond, it is growing because they are able to reach to us whenever there is a situation and they will need our help.
Mm. How can individuals get involved with behavior?
Now, it is not really a quite hard thing, just as long as you ask for a partnership. Yeah, we can work together and we can coexist in helping the lives of the people.
And what roles do volunteers play in your organization?
Okay, so the volunteers do help in really running with issues of awareness. As you all know that we do run outreach clinics. So for the people to be coming to this outreach clinic, it requires the volunteers to go around and within the communities to sensitize people on the development that is happening in their area. And that's when we really require the job of these volunteers. Right now,
Right. Coming to talking about future plans, what are Beehive's long-term goals?
I can say the long-term goal right now for Beehive as one of its pillars, in which it looks upon that each and every member of the community should be able to contribute to the community and also to his country. So as part of contributing to the community and his country, that person needs to be healthy and also needs to stay safe. So to work for us to work towards that goal, that's when we are introducing and also outreach clinic right there at our center close to St. James Catholic. We will be running also growth monitoring services right there, and we do have a special room in which the health facility will be coming to offer those services right at our doorsteps. So people around Chiromoni can be able also to come at Mother Teresa, that is where our office is located, to gain those health services.
Mm-hmm. Are there plans to expand partnerships beyond hospitals?
Yeah, there are plans to expand partnership beyond hospitals. As you all know that right now we're working only within our catchment area. But we understand this is an organization. The more we collaborate with other agencies and other NGOs, we will be able to reach a lot of people, not only in Chiromoni, but areas also around Chiromoni.
All right. I do understand the goals and perspectives of Beehive as an organization, but you, as a healthy coordinator, what motivates you to continue working in this field?
Uh, what really motivates me is I'm able to work in a field, as you understand, health desk. For someone to be coordinating things to do with health, that means the person has studied things to do with health, and we understand that the person really went to school to facilitate on things to do with health. But right now, I am a community development specialist, but I'm working in health desk.
Yeah.
Which means I am able to explore another field. Yes, I do understand that we are able to go join into other field, but in this field, I'm able to come across people, clients of different ethnic groups, religions, and it's really a whole new thing for me to explore. As you understand, health things, they're not just simple things. We really need people who are highly trained in those healthy things. But as for me, a community development specialist, to be involved in healthy stuff is really a whole new experience for me, and quite a new environment for which I'm still trying to explore.
Yeah. Okay. Have you witnessed a particularly impactful donation?
Yeah, I really have witnessed such a donation. It was in which we went for Chiromoni Health Facilities to donate personal protective equipment, as you already know. So it was really quite a wonderful thing, because at that time we were in the season of pink eye pandemic. Yeah, as we understand that Malawi, we were hit with another strange disease of pink eye.
Yeah.
So the things we had donated at that time were really impactful towards that pandemic.
All right. Okay. How has your work with Beehive influenced your perspective on healthy care?
Right now, it has really influenced me a lot, because most of the times when we take a look at healthcare things, we only go to the hospital because we really feel that something is wrong in our bodies, but we don't really take the time to review ourselves on how best we can care for ourselves in terms of hygiene and other things. And also when it comes to awareness on diseases, for example, COVID, pink eye, there are a lot of diseases in which we people, we just view them, but they are very simple for us to prevent. So my journey working in the health department, especially with the health facility, it has been an eye-opener in which I am able to understand some of these diseases in which we as Malawians, we can be able to prevent them, and also at the same time be able to teach the younger generation on how best they can improve their hygiene and mentality on such issues of to do with health.
All right. So at the beginning, you said that Beehive works to improve early years education. You also said that Beehive work with children with disabilities and also handling gender-based violence cases. What is the Beehive really all about?
So I can say Beehive is an umbrella. Yeah, there are a lot of departments in Beehive. But when it comes to our office, family support office, this is where we handle cases mostly, I can say, in on the early years education part. We do offer stay and play sessions for race privileged families in which they are not afforded to offer nursery educations to their children, so they do come once a week to our center to receive early years education. These are children starting from the age of 6 months to 6 years. That is what we really do to improve the early years education part. And also we work in partnerships with nursery schools within Chilomoni to also equip them and also train them in ECD education, which is early childhood education. Yeah, that's all I can say about the early years part. And when it comes to working with children with disabilities, we also have another segment in which we call that as special education needs and disabilities. In this field, we work with children who have disabilities. Yes, they do go for the hospitals for physiotherapy and other things, but they do come also to our center in which we are able to provide them with. We also do special education needs and disabilities sessions. We do conduct it once also a week. Here we do meet with children and their parents, mostly children with disabilities. Like here we offer physiotherapy services and also education services. The ECD platform, which is early years education, we also do provide it to these children. So that's all I can say about the special education needs and disability service we offer. As also family support office, we are an outreach team in which we are well trained in handling cases to do with gender-based violences and also child abuse. So we have a child protection officer in our office in who helps in handling those cases, but each and everyone is entitled to handle cases separately in the absence of the child protection officer. So most of the cases in which we have dealt with over the years include of children defilement, yeah, child abuse, child neglect, maintenances. So there are a lot of cases in which in this field we have a lot of success stories in which as an organization we have really made a name. Yeah, we do work hand in hand with Chiromoni Police Station, Child Justice Court. We also work with other organizations here in Chilomoni, like the mother groups. We also work hand in hand with them. The group village heads within Chilomoni, we do work hand in hand with them. We have also the Chilomoni Health Facility. We also work hand in hand with them in handling cases of child abuse. So it's really quite interesting that our office is able to do a lot of things all in the name of outreaching the lives of people in Chilomoni. So that's all I can say right now about Beehive. But there are a lot of sessions in which we do handle. We also have parenting sessions in which we meet with parents and we do educate them on how best they can be good parents to their children. And we also do talk about issues to do with family planning, cervical cancer, the heifer. You see that the heifer part, we are really talking about it with them in the sessions in which we will conduct. And at the same time, we do also offer opportunities for these parents in our tester programs. We do give them skills on baking, cookery sessions. So it's really a wonderful thing in which we are able to improve the lives of people through the programs and the services we offer in right here in Chilomoni. So it's really quite a special thing that the people in Chilomoni have really welcomed our services and are able to tap into those services and be able to benefit from them. That's all I can say right now.
Okay. You didn't explain one thing about GBV cases. You forgot it, I guess.
Yeah. Like on the GBV cases, yeah, we do come across gender-based violences. As we all know that Malawi in the past years, we had a lot of cases to do with gender-based violence. And as also an organization, we are also working to eradicate those cases. We do work hand in hand with Branted District Social Welfare to handle such cases. There are a lot of women in and also men who are coming, really stepping out to disclose the kind of abuses they face in their marriages or even within their communities. So on the gender-based violence part, there are a lot of cases in which we are handling. Most of the cases include they have separated, the husband is not even offering any support, or the wife is being beaten instead the marriage. There are a lot of cases in which we really do handle as Beehive. Yeah.
All right, thank you. We're coming to an end. We are closing. But is there a message you would like to share with our audience?
Yeah, there is a message in which I would like to share. Mostly Beehive, our main goal is to see that a child grows into a better citizen. So, as one way of seeing that a child grows into a better citizen, that is when we do encourage parents that parenting, it is not just raising a child, it is a calling. Each and every parent should be able to know and understand the likes and dislikes of the child. I do understand there are a lot of issues we face, as for example, the teenagers. Once they reach puberty stage, if we miss that stage in the life of a child, it is very difficult for us to regain it. So as Beehive, we really work with parents, we really work with children. We do offer even also education to those kind of children in our Young Cares program. We also meet with the youths on how to train them on how they can become better citizens. So we do try to maintain their behaviors. If we do not control the behaviors right now, that means if we miss that stage, it's going to be difficult for us to mold that child to become a better citizen again. So as parents, I do encourage that as we are seeing our children grow, we should make sure that their behaviors they portray, the behaviors in which we see our children really showing to their friends, are they really acceptable to the community? Will they really be able to help them in the time being? So as parents, it is our responsibility that apart from securing that child, we should be able to cover that child from each and every abuses that they face within, because right now most of the abuse cases come within the family, come within from the people who are supposed to protect that child. So parents, it is our duty to protect them.
Okay, so how can people learn more about Beehive?
Well, they can visit our social media platform, which is Mary Queen of Peace Africa. I do understand the name do differ. Yeah, it's Mary Queen of Peace because we are Beehive is like an umbrella. So there are a lot of things in which a lot of departments in which are under Beehive. So we, Mother Teresa Outreach Team, we are under Mary Queen of Peace, which is an education party in which it is looking after the whole Beehive. Yeah, I can say that. So when you visit our social media platform, you see a lot of things in which that are happening on Beehive. Yeah, the projects, the people we're getting in touch with. Yeah, it's really quite a wonderful platform. You really learn more about Beehive and understand why it works towards.
All right. Do you have any final thoughts or reflections?
Yeah,
that's my last question.
no, there are questions right now, any thoughts and reflections. Just that, yeah, it was really wonderful that we are here to give people an insight on what Beehive is all about. Yeah.
And thank you so much for coming on the podcast. It was a wonderful thing talking to you. I've learned a lot about Beehive. And I hope my audience has also learned a lot about the organization.
It's my pleasure. Thank you.
So that's the end of this episode. You are? All right, so, okay. Until next time, don't forget to like and comment. Until next time on another episode of The Blend. Bye.